Right, let's get on to today's big talk of the UAE's cosmetic surgery market is, well, expected to grow significantly due to the rising demand for, well, a number of aesthetic procedures. With us now is consultant plastic surgeon Dr. Adil, who is in town to oversee operations at the Cosmetic Dubai Hospital. Absolutely, an absolute pleasure to have you, Dr. Adil, joining us. And I mean, your skills are so much in demand here in the region at the moment, and further afield as well. I think by your very presence in Dubai, can I read into that? That I talked about the growing demand for the cosmetic surgery market, but how well established is it at the moment, and what is the potential of it here in Dubai?
I mean, there's always potential when it comes to aesthetic medicine and aesthetic surgery. The demand has always been there. You know, it's just we're trying to feed into that demand. You know, so yeah, it's a growing market. People are getting more and more hooked on you know, looking better in general. So yeah, the future is good.
And is this in terms of sort of destination procedures? Now, we often hear about medical tourism and people flying to different parts of the world, etc. Again, is Dubai, is the GCC becoming a market where people will fly to have a procedure?
It's getting there. It's not
getting there.
Yeah, it's not. It's not there. It's not quite there yet. I'm in Kuwait, where I basically operate 2 weeks of the month. Was, if you go back like maybe say 15, but even 10 years ago, was the hub. So people from the Emirates and Saudi and you know, all GCC countries would go to Kuwait to have the procedures done, if not Lebanon or other places. But yeah, Dubai's, I mean, Dubai is a different market, you know. I mean, you've got so many nationalities, so you know, there is this need to have more and more plastic surgeons, more and more aesthetic doctors and all that. So yeah.
So doctor, I was thinking, what's the stats in terms of like male clientele? Have you seen a rise in male
For
clientele?
sure, yeah. In the last 10, 15 years, I mean, you know, out of 10 patients that walk into my clinic, there would have been like at least 9 females and one male. But now it's increasing now, maybe it's like 30%. Yeah. So men are getting into this game also, you know. So
what specific
equal
things
rights,
are they having?
Men mostly. It's hair transplants, rhinoplasties, nose jobs, liposuction. That's always number one, liposuction. And of course, with the advent of all this bariatric surgeries, you know, people that lose a lot of weight, they have a lot of skin redundancies and excess. So post-bariatric plastic surgery, when you cut off the excess skin, we're seeing a lot of that, yeah. And of course, things like, you know, man boobs, gynecomastia and all that. So, yeah.
Sorry, gentlemen, I'm going to bring it back to the ladies.
Yeah.
If those are the top procedures being done for the men, are there any trends right now when it comes to procedures being done for women?
Liposuction's always been on top of you know, of the list, always. But BBLs maybe in the last 5 to 10 years, you know, with all the influence from social media and you know, so a lot of people are demanding that. I mean, you go back 20 years ago when people did liposuction, they all threw the fat away. 90% would throw the fat away. And now it's the opposite. 90% will keep the fat and re-inject it, you know, to different parts of the body.
So it's always a 2-in-1 procedure nowadays,
Yeah,
or more
for
often than not. You go in for liposuction, you get a
and fat
BBL,
transfer,
let's say.
yeah. So
How much of the consultancy process is managing expectations and managing over expectations?
well, see, as you get veteraned, as you grow wiser, and you yeah. I mean, there's no other way to put it, you know, because you learn from the lessons. There's always that one person that you say, I wish I never operated on that person, you know. So expectations, realistic expectations, that's what you get good at when a patient comes into your clinic. So you kind of look at the patient, and you know, when you're a young surgeon and all that, you want to operate on everybody, yeah. But now, you know this patient I'm never going to touch, you know, because either their expectations are too high or they're just unrealistic, and you know, and basically they're maybe reacting to a circumstance that happened in their life, and it's just a rebound thing.
Yeah.
Yeah, we get wiser, and then we know when not to operate.
Yeah.
That's I think what makes a good surgeon these days, you know.
And is social, diving into the social media question at the end of our little chat, because we're going to wrap things up shortly, but in terms of social media, I mean, what's your reading of social media? Is that helping that management of expectations?
It's a huge topic. It's a huge topic, you know. I mean, to try to sum it up quickly, social media is good when it comes to educating the public, you know, and you know, education. It's bad when you know, it's in the wrong hands, and you get influencers or fashionistas promoting a place or promoting a doctor for, you know, for money, and that's when not all the public are, you know, they're not. They might not comprehend, and they'll say, "Oh, okay, she said he's good. Let's go," and then that's where problems happen. You know, there's a responsibility that comes with that too. And of course, now at the moment, like, you know, you go back with marketing 20 years ago, it was newspapers and the radio and word of mouth. Now it's like who has a bigger presence on social media, you know, who pays more for Google and all that kind of stuff, gets there, and then, you know, so it's yeah, it's a different game. Totally different game.
Plenty to unwind and look at for the rest of the show. You're going to be here for the whole duration.
Well,
thank you very much for being here. So we're going to take a quick break, but coming up after the break, we'll be chatting to the former beauty director of Vogue India, and she is now the founder of e-commerce beauty website Noor. Stick around.